Hey, Dr. Mike Sevilla here from the Salem Community Hospital, and I want to talk to you about our new low-dose lung cancer screening program. And I talked a little bit about it today on WKBN, but there's only so much that you can talk about in a couple of minutes. So I wanted to give you a little bit more detail about it. And don't worry, I'll play the interview at the end of my comments here. So lung cancer screening, we want to try to show it's kind of similar to the breast cancer screening model in that we screen people who are at higher risk and without or with very little symptoms. Which can be kind of a little bit confusing, but we want to catch the lung cancer early so we'll be able to treat that. Questions that I got already as far as what's the cost of it? It'll be $99, and it is not covered by insurance as of this point. Hopefully in the future it will be covered. And who is this targeted at? And what happened to my camera there? Who this is targeted at is high-risk patients, and there is a huge amount of criteria on who qualifies for this at the hospital website, salemhosp.com, salemhosp.com. And just reading from this list here, it is age 55 or older, smoking history of 30 or more pack years, or quit smoking within 15 years. I know that's can be confusing. And then this other one is age 50 or older, smoking history of 20 or more pack years with increased risk factors for lung cancer, including COPD or emphysema, environmental/occupational exposure, prior cancer, radiation therapy, genetics, or family history. And the third criteria is lung cancer survivors. So one of those three, which I know is very confusing. I'll try to put that at the end of this video, and you can also go to the hospital website at salemhosp.com. Now, those who are not eligible are people who are symptomatic, people with chest pain, pneumonia, wheezing. So this is a screening test. This is not a diagnostic test, which is very important. And also people who are not eligible are people who have had abnormal chest CT scans in the past. You're not eligible for this program. And there is some financial aid that is available, but you can call the hospital number here at 332-7131 for more information. So that was the information that I could not convey on the air, but it's also very important as well. And it's all about finding the cancer early, especially lung cancer, which is the most commonly diagnosed cancer. There's more cancer deaths from lung cancer than from breast cancer, colon cancer, prostate cancer, all combined. So if you know of somebody, you have a loved one that you're concerned about lung cancer, then call the hospital for more information. You can also contact your doctor as well. But let me give you that hospital number again. Here it is 332-7131. You can also get more information at the hospital website at salemhosp.com. And here is my interview from today at WKBN.
Welcome back. Dr. Mike Sevilla from Salem Community Hospital is here today. We're here to talk about a specific type of cancer. It's not breast cancer, it's not colon cancer, it's the leading death cause in America, lung cancer.
That's right.
And one of the most important to detect early on as well, correct?
Yeah, and what we know is that lung cancer is the most commonly diagnosed cancer in the United States. And interestingly enough, if you put the statistics together, there's more lung cancer than breast cancer and prostate cancer and colon cancer, all of that combined.
Combined?
So, yes.
Okay.
Yeah, so it's very important to detect that early.
And you say annual screenings are one of the best ways that you can do that, because if you don't detect it early, then the chances of catching it, well, not catching it, but
that's right,
nipping it in the bud, so to speak.
And what we've seen, especially like in the breast cancer model, is that when we do yearly screenings, and there's a lot of literature out now as far as lung cancer screenings, and that's why it's an important program that we have at Salem Community Hospital now as far as our lung cancer screening program.
Tell me more about that program.
Well, the lung cancer screening program, it's a new program that just started this month. There's a lot of other hospitals have been doing that already. The cost is $99, and it's not covered by insurance at this point. Hopefully, we're going to get that covered in the next few months or years. And what we've seen is that there's qualifications that we're seeing at the hospital. There's a certain age, a certain smoking history, and if you're a high-risk patient for lung cancer, those are qualifications to have that type of screening done.
Hopefully, we can get that covered by insurance, because then more people surely would get it if it wouldn't be at that cost.
I think we're just going to need to get more information and data on it, and I think that's going to be coming in the near future.
Okay, good. Well, thanks so much for coming in.
Thank you.
Appreciate it. If you're looking for more information on those screenings, you can call this number, and you can go to our website if you don't catch this number right now, and watch this segment online for that information as well. We'll be right back after this.